The pandemic is another public health challenge for drug users in Scotland who, before coronavirus, were dying at the highest rate in Europe. Now a GP in Edinburgh has put together a package of support, including getting medical students to deliver methadone prescriptions to those who can't leave their homes. Our social affairs correspondent Michael Buchanan has the full story.
In these strange times, drug workers have become vital couriers, delivering methadone to heroin users who have to isolate.
Can you confirm your date of birth, please? Right, can you just take a wee step back? I'll leave it on your map for you. Okay.
It's all part of a huge effort to protect some of Edinburgh's most vulnerable residents from COVID-19. With no tourists to accommodate, this hotel is housing around 80 rough sleepers. Anyone showing symptoms of the virus is immediately tested. Though no one has yet had the disease, a section of the hotel has been turned into an isolation unit to care for anyone who becomes ill.
If the virus spreads extensively through my patients, our practice population, then there will be high numbers of fatalities.
Much of this effort has been led by Dr. John Budd, a GP who works daily with the homeless and those with addictions.
People who are homeless often have multiple underlying difficulties. And unless we help them to address some of those underlying issues, then with regard to COVID, then they're not going to be able to actually keep themselves safe and other people safe. So if someone has an addiction issue and we're asking them to self-isolate, they're going to be unable to do that unless you actually help them to tackle the addiction.
Scotland is dealing with two public health crises simultaneously, the pandemic and Europe's highest level of drug-related deaths. The Edinburgh initiative includes offering heroin users the option to switch to methadone immediately instead of waiting weeks.
Very difficult.
For James and Chloe, getting their medicines delivered to a different hotel, staying safe in shared accommodation is hard.
Anyone could catch anything in
It's
here.
quite crowded.
Because there's two kitchens and we have to share them all and you don't know
Who's got what, and people don't clean up after themselves, they leave their bits, and people are sneezing, then not washing their hands, and then
it's quite horrible.
horrible.
Mostly I think people are feeling quite anxious, and it's quite difficult to focus on other things that aren't their substance when they're not allowed to do anything else. Do you know, because one of the key things that we get people to do is get out and about, distract yourself, and actually now we're telling them do not do any of that.
Back at the hotel, residents have access daily to a GP.
Have you got any health problems?
Staff find the rough sleepers are seeking help, wanting support. A remarkable about-turn, considering some have spent years refusing to engage.
Miss my life, Miss my life completely.
For Grant Moffat, who spent 3 months sleeping rough, the sanctuary of the hotel has afforded him the chance to reset his life.
I'm using it as an opportunity, yeah. Miss my family, you know, think a lot about my family and stuff that I might never have. We sort of being on the street and just getting up in the morning, you know, a drink, you know what I mean, forget about the day. Waste.
Edinburgh is trying to both protect its homeless and drug-taking residents from COVID-19 and offer them a future when normality resumes, using a global pandemic to tackle a national crisis. Michael Buchanan, BBC News, Edinburgh.